Welcome to the show discussing problems and issues of health with Dr. Alcena. For this segment of the show, I'm going to talk about autoimmune diseases, in particular platelet-associated autoimmune diseases resulting either from autoimmune disease and or for by itself. When I left off last week, I was talking about a condition called ITP, immune thrombocytopenic purpura. That condition is a condition in which your platelet becomes low. And there are many, many ways to determine why is the platelet low. Is it low because there's an infection? Because in a hospital setting, the most common cause of low platelet is infection. Is it low because it's a condition called DIC? Is it low because a condition called a TTP? Is it low because the spleen is too large and then it's sucking up the platelet, etc.? Is it low because the patient has lupus or rheumatoid arthritis, scleroderma, Sjögren's syndrome or whatever, and or Hashimoto's thyroiditis, celiac disease, Evans syndrome, and so on and so forth. So I did the entire workup, and I was talking about how you go about treating the symptoms of ITP and the ITP itself. And the symptoms, of course, is usually bruising, excessive bleeding, petechiae, which is sort of a rash, elevated little reddish rash all over the skin, heavy menstrual blood flow, heavy bleeding during delivery of a baby, on and on and on and on. So I did all the workup. Now I was about to treat. And when I left off, I was talking about Dr. Percy Julian. The reason why I brought up his name is because steroid across the world is the least expensive medication that's being used to treat ITP and a whole host of other medical conditions. And of course, it is Percy Julian, Dr. Percy Julian, who actually invented corticosteroid and steroid as we know it being used nowadays, and has been used for many, many years since he developed it. And I give the history about a little bit of background involving Dr. Percy Julian and the fact that he was the Negro gentleman who went to school in this country, this is his country, United States of America, get a master's degree, but he also wanted to go on to get a PhD. Well, they wouldn't allow him to get a PhD because he was a Negro. And this gentleman had to go all the way to Scotland in order to get a PhD, and he did. And when he came back to this country, of course, he did a whole bunch of stuff. He lived right here in Greenberg and died right here in Greenberg at age 76 when he did pass away. And then he did so many, many, many things, but the thing that he's most well known for is the fact that he biosynthesized corticosteroid. And the modern day physicians who are using steroid 24/7, they don't even know anything about Dr. Percy Julian. They don't even know he's the one that invented corticosteroid. He was also the owner and the creator of Upjohn Laboratory, the owner and creator of Klein Laboratory, etc., etc. He even had a branch of that in Brazil, etc. Became a very successful man, and so he invented corticosteroid. And I left off talking about other things that he did in addition to that. If all of us who have a little gadget in our home to put out fire, the foam that's in that little thing that we used to put out fire, he invented that foam. And that foam, based on history, was also very helpful when the big battle came in Normandy, that the U.S. was able to put away the fires that the German was bombing the U.S. machinery. You could put out the fire, etc. So this man made an incredible contribution to the world and to the world of science, and yet you know nothing about him. You never heard anything about him. So I thought I would mention that and give him credit for the one that, of course, invented steroid, which is the #1 medication in the world that's being used to treat ITP. And the reason why steroid is able to do so, because steroid can interfere with the formation of the antigen-antibody complex. It is the antigen-antibody complexes that the body is reading as a foreign agent and sucking it out, the spleen in particular, taking it out, thereby you lower your platelet. However, if steroid works, sometimes it doesn't, but if it does work, then that solves the problem. Right? Unfortunately, steroid have major long-term side effect when it is being used chronically. So because of that, sometimes they used to have to do surgery to take out the spleen, because the spleen is the organ that's the most involved in taking out the platelet. There are other reticuloendothelial cells that are taking them out as well, but that's minor. The major one is the spleen. So, but nowadays, none of that has to be done anymore because now we have two other medications. We have IgG, intravenous IgG, which has been out for quite a while. You could do that. But even more importantly, in recent years, you could use Rituxan. Rituxan is a substance, quite expensive, but it's a substance that is used, is the result of the D20 lymphocytes. And once the Rituxan killed the D20 lymphocyte, we can't form antibodies without the D20 lymphocyte. But the Rituxan wiped those things out. So Rituxan is fantastic. It wasn't created for that. It was created basically to treat Hodgkin lymphoma, and now all over the world, myself included, constantly using Rituxan, either to treat different type of lymphomas and or to treat autoimmune hemolytic anemia, myositis, polymyositis, on and on and on and on. Okay, I have patients on it right now. So the Rituxan is fantastic. So this is the latest medication that's most available to treat ITP is the Rituxan, the best. How do you know when there's a response? Well, you monitor the platelet count by doing a blood count as the patient is being treated every week or so. And then you have to understand also, when one has ITP, you don't necessarily always need treatment. That's right. You could walk around, the normal platelet count is from 140,000 to 400,000. So you're not going to be spontaneously bleed unless your platelet is below 20,000. Let me repeat that. You're not going to bleed spontaneously unless your platelet count is below 20,000. However, if you're having surgery, or a lady is having her period, or delivering a baby, or you get into a traumatic accident, unfortunately, anything having to do with a lesion, then you could bleed, and bleed massively, because the platelet don't aggregate. In order for platelet to prevent bleeding from taking place, the platelet must aggregate. It is the aggregation that helps the formation of a clot that begin the process of stopping bleeding. Very crucial. But unfortunately, when you have ITP, the platelets are qualitatively abnormal because they're not going to aggregate. And they're quantitatively abnormal as well because the quantity is less. So this is ITP for you. Quite common, 1,000 individual, no 1,000, 100 per million folks across the world have ITP. Very, very common. That is all I'm really going to say about ITP. Now, let's talk about another platelet problem, which is called thrombotic thrombocytopenic purpura, TTP. Problem is, TTP is different from ITP in many ways, because TTP is not a bleeding problem. It's a clotting problem. Yes, the platelet is low. If you were to cut the person or there's a laceration because the platelet is low, you will bleed. But TTP, I'll explain to you why. TTP is not by itself, by nature, a bleeding problem. TTP is a clotting problem. You have a situation where the platelet is low and yet you're clotting. That is why someone will present with a long list of different conditions that can be associated with TTPs. It could be a heart attack, it could be a stroke, it could be kidney failure, it could be anemia, and so on and so forth. And yet it is TTP. So you would evaluate the patient by taking take a complete history from the patient, do a complete thorough examination. Then you go into, after the examination, then you start doing blood tests. Well, the most important blood test you're going to do, of course, will be a complete blood count. And in this case, the platelet count will be low. Okay, so the platelet count is low, but you don't know why yet. All you know, your patient is very sick, super sick. The kidney is failing. Patient may have a stroke, heart attack, and yet the platelet is low. So, in addition to that, you will do a complete metabolic profile to look at the liver function test to tell you whether or not the patient has some issue involving the liver that can be the reason why the platelet is low. However, in the case of TTP, the renal function test, which is part of complete, will be abnormal. So you have abnormal kidney function test, and right away, if you know this stuff, you proceed to do a PT-PTT. You have to do a PT-PTT. And I'll tell you why in a minute. You do a PT-PTT. But we're talking about autoimmune disease. Again, you go ahead and do a SEDUIT. You do an ANA. Always do an ANA. You do rheumatoid factor. You do a CPK. You do an LDH. You do reticulocyte count because you want to make sure your patient is not hemolyzing at the same time, and so on and so forth. We did all these tests, and then nothing really, the PT-PTT comes back normal. The ANA may or may not be normal, but you still have an issue to deal with. Your platelet is low and your patient kidney is failing. The red flag should raise quickly that you're dealing with TTP. How do you know? Well, first thing you should do, number one, is to call a hematologist. And you're better off, in particular, calling a academic hematologist. Because academic hematologists are not only practicing hematology, they're teaching it, they're writing it, they're lecturing it. They know all little details of everything. Right away, you just did the PT-PTT, and it's come back normal, and your platelet is low, and your patient's kidney is failing, or your patient is having a stroke. And a smart hematologist will go right to the laboratory, run right to the laboratory, and ask the lab technician, can I please take a look at the patient's smear, blood smear? Well, he or she is not looking to see how many platelet is on the smear. Well, they know the platelet is low. What he or she is looking for is a condition called looking for schistocyte. What are schistocytes? Schistocytes are red blood cells that are all chewed up. They're all chewed up. There's little pieces falling off all over the place. Right away, the red flag should go up. Now, I want you to pay close attention. I mentioned the word ITP in the past. I mentioned the word DIC in the past. Now I'm talking about TTP. The trick is that if it is TTP that's causing the platelet to be low, the hematologist look under the microscope, he or she will see schistocyte. That is chewed up red blood cell. What's going on here? Why those red blood cells get chewed up? They get chewed up because in TTP, this is what I want you to pay close attention. Inside the blood vessel, the platelets are the little platelet plug throughout the major vessels. That's where the stroke comes in because of lack of perfusion. There's kidney failure because of lack of perfusion of oxygen to the kidney because the platelets are getting aggregating inside the little vessels, which is quite different from ITP when they're not aggregating. Over here, and then as the blood is passing through this vessel, the forcing, the forcefulness with which the blood must do in order to pass through those vessels, causing the damage that are occurring to the red blood cell. Let me repeat that. All vessels, small vessels, no matter how deep they are, the platelets are clogging them up. So the red blood cell is forcing to pass through. The forcing to pass through phenomena is causing the damage that's occurring in the red blood cell, resulting in schistocyte formation. How about that? Right away, the diagnosis has been established. That's got to be TTP. But be careful. There's one more thing you have to keep in mind. because the same phenomena will occur in a different way if the patient has DIC. However, here's the key. Here's the key. Here's the key to put in your pocket. In DIC, the platelet, the PT and PTT will be abnormal. How about that? The PT, PTT, the abnormal PT, PTT will put the same phenomena in the category of DIC. If the PT, PTT is normal, and you have the schistocyte with the low platelet, that is TTP. Why is that important? 100% important, because the management of TTP is 100% different than the management of DIC, which is a different thing. DIC is a condition that develops usually in a hospital setting in a very sick patient. Either the patient gets very infected and or septic, and the patient drops the blood pressure. Once the blood pressure is dropped, then there are material, procoagulant material get developed because of once the pressure is low and the lack of perfusion in the tissues result in the delivery of certain substances that stimulate the production of procoagulant that set up the phenomena of DIC. Okay? Completely different. The management is different. Completely different. So, the TTP then is a multi-system disease because the platelet goes everywhere. And wherever there are blood vessels, you can't have tissue that does not have blood vessel. Otherwise, the tissue will die. From the big toe to the earlobe must be perfused. Well, they're being plugged up because of TTP. The platelet is dropping, not because there is not enough platelet in the body, yes, but it's the worst thing that can happen because the platelet in the body is aggregating, causing clot, tiny little clot to occur throughout the vascular system. That's where the platelet is going. You're making the platelet, but you can't see it because the damage is, okay? So the total platelet is low because the abnormality here is a aggregating platelet, it's a clotting problem. And you can't, this is one of the diagnoses that cannot, let me repeat that. This diagnosis that cannot be missed. If you miss that diagnosis and you take too long to make it, the lack of perfusion to this different organ may have already occurred to a point where those organs are not recoverable. Let me repeat that. This is diagnosis that cannot be missed. And it must be made quickly and fast because you need to do something to dislodge the little plug that's inside those little vessels so that blood can go through freely, oxygen can pass freely, and perfusion of different organs can occur. I'm not going to sit here and apologize to you or to anyone for that matter, even though I'm being forced, which will never happen, by folks who don't know a trillion of what I know because they put them in charge, and I'm supposed to be apologize for knowing 10 million more than they do. They will even if these people were to live 10 million years, they wouldn't know 20% of what I know because they don't have the brain power. Look at, I'm sitting here explaining all this stuff to you from the top of my head. That is why I just received, I don't mean to brag, but I'll share it. I just received one more time my grade for teaching at Einstein this year. Again, 4.0 for everything. That's the perfect 4.0. I just showed it in my little cell phone here to my friend that helped to do the show inside. 4.0. And all from the top of, I don't teach with books in my hand. From the top of my, because I know this stuff better, I know the color of the palm of my hand. And I'm supposed to apologize because I'm teaching in a very good, I mean, it's very good community hospital, but it's a community hospital. There's no teaching taking place there. That doesn't make it, in fact, it's a superb hospital. That's where I go if something happened to me. But that doesn't mean you don't have bad things occurring there. Yes, and folks who are jealous, envious, and flat out racist, who doesn't like the fact that they have a man of color walking around with a few dollars in his pocket, his hand is up. I'm not begging them for a job, One time a job was offered to me at that hospital. I'm going to make you laugh. The response that I sent to that guy who was no longer there, who was the tyrant running the place, I told the guy to tell the guy, listen to me, even if I were on the Sahara Desert and I hadn't had water for 6 months, and this man offered me water, I wouldn't drink it because I know there would be poison in it. This was my response to the job that was offered to me to do something at the cancer center. I told him he can go to hell and stay there. Okay, keep his job. I don't, because this was the idea to shut me down, to offer me a job so that they can control me for what? I have no idea. Why do I need to be controlled? What it is that I'm doing wrong? To be controlled because I'm knowledgeable? I need to be controlled because of that. Give me a break. I earn my knowledge. If I'm powerful, it's knowledge that makes me powerful. If they're powerless, that's the stupidity that makes them powerless. It isn't my fault they don't have the IQ that God gave me. God gave them privilege. They have social privilege, economic privilege, political privilege. But for crying, they do not have professional privilege, not when I'm around. When I'm dead and gone, yes, they can go ahead and pretend to be. I couldn't care less. They can't do anything to me. Nothing. Zero. That's for God to decide. God did not make me. If God made God, if they made me, frankly, my IQ wouldn't be this high. Okay. So getting back then to TTP, you cannot miss a diagnosis because we're talking about perfusion. If an organ remains without oxygen for too long, the tissue is going to die. That is why you must be able to determine whether your patient has TTP, DIC, ITP right away, within minutes. You must do that because the way you handle TTP is different from the way you handle DIC. DIC is a different thing, a bird of a different feather. So I'm not going to give somebody who has DIC aspirin, but if somebody has TTP, you don't give them aspirin, how are you going to dislodge the platelet that are clogging the vessel? You must give them aspirin even though the platelet is low. What choice do you have? You don't. The only medication available to dislodge this clogging of the platelet is to give the patient aspirin. The aspirin will prevent the aggregating process of this little platelet so that blood can go through. What do I care if the platelet is 20,000? I can give the patient blood if he or she bleeds, but I'm saving a life. If you don't know that problem, that is your issue. I don't have that issue. That's your problem. So this is TTP. This is a very bad condition because it's a multi-system disease. It does not take multi-million-dollar machine to make this diagnosis. By walking to the laboratory, ask the lab tech, can I please see the smear? By sitting down under the microscope, looking at the smear, you see these red blood cells that are being chewed up, and the platelet is low. When you're looking at the smear, there should be platelet on. I'm not even looking at that because I already know the platelet is low. I'm looking for schistocyte. If I got schistocyte, I have low platelet, my PT is normal, I just diagnosed TTP. I don't need any machine. This is it. That's simple. It takes an hour to do, less than that. And you could throw all the money away, do all these expensive tests, doing CAT scan this, CAT scan that, sonogram this, all this nonsense, calling this specialist, fit 3 or 5, 6 doctors, take the patient there. No, that's going to help you. Keep going. They're not going to help you. What's going to help you is have someone who's an academic doctor, and I keep stressing academia, because academia takes time, my friend. It's a lot of work. A lot of work to study, to keep in the knowledge. I receive 18 journals per week, and I read all of them. And I teach for years. For years. The only place I had a little place that paid me a few dollars to teach was at Cornell. Every place that was for free. And I was telling a friend of mine yesterday, that little job that I had at Cornell saved me. because Cornell in those days has an annuity problem, an annuity program. So when I was teaching there, they give me the sheet to fill out. I see the word annuity. I didn't have a clue what annuity means, if to put money in there. So I click it. I put annuity. It turns out that little money that I put in the annuity is why I'm sitting here talking to you. Because after they've done all the nasty thing to me in White Plains to prevent me from building my office, to prevent me from even making a dollar practicing, it turns out that I had a little money that nobody knew, that I didn't even remember, and an annuity account that when I was teaching at Cornell for almost 10 years. How about that? That little money helped me to get into a little real estate here and there, and now I'm financially independent. They did everything, and they did. Yeah, it's not that difficult because these people have so much power over you. You have no idea how powerful these people are who are running a hospital. They can do nothing to help you to build yourself, your profession, but they can destroy you in 5 seconds. And they have attempted. They've destroyed so many people. You have no idea because of being evil and vicious and cut slashing so that they can be the one making the money. Working on it won't even be bad if some of them knew what they were talking about. That's the worst part. They get involved in medical politics so that they can control to make money, not for the benefit of the patient, for their pocketbook. That sickens me because as somebody who's been sick, 3 times I had cancer. 3 times I had to diagnose myself. I took the chance of allowing myself to ask for these people to treat me. They almost killed me. And I had to treat myself. So that's why I'm a patient advocate. I will fight for patients until until the day I stop breathing. Okay? And I'm going to apologize for people who are powerless when it comes to knowledge. And me, the little power I have, it's all I have. Look at me. I'm a man of color. All I have in this country is knowledge. That's right. And that's the power that nobody can take away from me. They try everything else. Let them keep trying. So therefore, then TTP must be diagnosed quickly, must be treated quickly. The best medication is an aspirin-like medication to dislodge the little platelet plug inside the vessel to allow blood and oxygen to go through to save the organs that are dying. That's it. That's the bottom line. But you must make the diagnosis first. And if you don't have the brain to make diagnosis, find somebody who have the brain to do it. You have plenty extraordinary, intelligent, brilliant doctors around. Ask them for help. Listen, I'm going to stop here until I see you again. This is Dr. Alcena saying so long and bye-bye.